24 hours to 8 p.m. last night, and about a third of these came from rat tests. There were 2,230 PCR tests and an unknown number of rapid antigen tests taken yesterday. There are approximately 3,730 active cases across the Territory, and these cases spread across the Northern Territory, as you would expect. Just over half of these are people aged between 20 and 39, so we're still seeing that age bracket having the most COVID, and 75% of these cases are in the Greater Darwin area, about 15% in Alice Springs and surrounding areas, and 5% in the Katherine area, about 4% in East Arnhem, and the remainder of those are across the Territory. To Yuendamu, there have been a further 2 positive cases in Yuendamu, and that brings the total to 45. 14 of these people are remaining in the community at the moment, isolating according to their wishes, but we are working very closely with them. I'm also very pleased to report that Yuendamu have significantly lifted their vaccination rate. The Chief Minister went over that yesterday, but again, I want to say thank you to those in Yuendamu who have gone out and gotten that first dose of vaccination. They are now at 81% first dose. This is a significant jump for Yuendamu. Well done, and keep getting vaccinated. Yuendamu and Yullamu, they're going to be in lockout until Thursday, and there'll be certainly a lot more testing happening in that area to manage this current cluster. To other communities, we have seen 4 cases from Yirrkala. However, 3 of those were already in Darwin isolating, and the 1 other person associated with that was a close contact to the 3 that were in Darwin. We have sent in an extra 6 health workers into Yirrkala to do testing there, to make sure we get out there and do as much testing in Yirrkala as possible. Pleasingly, there were no new cases in Amungana or Hermannsburg overnight. At the Alice Springs Correctional Centre, there are now a total of 20 cases there. We have 6 of those in staff and 14 inmates. The centre has got a COVID management plan in place. They are testing everyone. We know that we've got high vaccination rates in those correctional facilities, but there is a huge amount of work happening there. We've also had 4 cases at the Alira Renal Hostel in Alice Springs. 3 of these cases are residents and 1 is a staff member. So these are people that are in town getting renal treatment. So again, there is work happening with the hostel to make sure that those people are getting the very best care given they have those underlying health conditions. There were also 8 cases at the Alice Springs Forensic Facility, and 7 of these were inpatients and 1 was a staff member. And again, there will be a COVID management in place, making sure we're doing the testing and that those patients get the very best possible care. We have seen overnight thousands of text messages go out to Territorians, making sure that they're aware that they have visited an exposure site, and we've still got thousands more that will go out today. My message to people is to make sure, don't get alarmed, but make sure you do monitor your symptoms. If you are symptomatic, go out and get a COVID test done. If you have been at an exposure site, if you go symptomatic, make sure you get that test done. So I'll just hand over to the Deputy Chief Health Officer, but again, to the lady who has passed away, her family, and to the Bagot community, our deepest sympathies.
Thank you, Minister. Thank you, everyone, for coming. I also want to express my sincere condolences to the family of this young woman who died overnight. As we've heard from the Minister, she was in her 40s. She had been vaccinated, had 2 vaccines. She hadn't had the opportunity to have a booster dose. Vaccination is still our best defence. We will see, unfortunately, occasionally people who have been vaccinated who will succumb to this illness. But booster doses are that best extra defence against this disease, particularly the Omicron variant. We don't know at this stage what variant this unfortunate woman had. This will have an impact on that community. We are seeing around the Territory still people responding well to outbreaks in their communities to get vaccinated, but we need people to get vaccinated in advance. We still have a number of communities where there is vulnerability, where people are below the 80%, where the community are below the 80% threshold that we would be more happy with. So I'd ask again, please come forward. Those vaccines are available. There's no shortage of vaccines. You will be able to obtain vaccination. So please come forward. Thank you.
Thank you, Minister. Thank you, Doctor. I also would like to offer my deepest condolences to the extended family of the young lady who passed away last night. It's a sad moment in time when it's going to be affecting those family members, the people that cared for her, and wider Territorians. The importance of adherence to the compliance of the CHO direction. Please continue, Territorians, to adhere to the mask mandate. Utilise the check-in app. It's really important for the collection of data and advice to you, as we've seen with the messages that have gone out overnight. Practice social distancing, practice good hygiene, and wash your hands often. And if you have symptoms or feel unwell, be cautious, isolate and get a test. Get a PCR test, and if it's positive, please record it on the portal so the CDC team become aware. This is really important work across the Territory. I'd also like to draw to your attention a flood watch that's been issued for Central Australia for the Western and Tanami Desert area. We see ex-cyclone, tropical cyclone Tiffany come back into the Northern Territory. Over the coming days, there's a low depression system which will offer 70 to 120 mils of water, which will affect Yuendamu, Yuelamu, Kintor, Docker River and Yulara. We'll see roads cut off, we'll see localised flooding. Messaging has already occurred in community by our local controllers through our regional controller in Alice Springs. There are sufficient stocks in stores across Central Australia. Make sure community members have provisions for the next 72 hours, water and food, so if they need to stay at home, they can. Do not travel. Restrict unnecessary travel. If you have to travel, please tell someone where you are going and what route you are taking. If there's flooded causeways, under no circumstances cross it. These waters move fast and are treacherous. Please look after each other. Listen to the BOM and our emergency services personnel to make sure you're informed to look after yourselves and community. Thank you.
Can I just ask why we don't have a number of rat tests today?
Because rat tests are distributed. Some people go commercially, buy rat tests and so forth. So really it's about the number of positive rat tests that are returned. That's the concern, and we did mention that in the opening statement.
You mentioned that there's no one in ICU at the moment. There was one yesterday. Was that this woman that passed away?
Yes.
Do we know what strain of COVID she had?
I don't have that information with me at this point, but generally we've been working to Omicron because it has rapidly gone throughout the greater Darwin region and the urban centres. Prior to that, we were dealing with Delta through that Catherine cluster.
Cases at the Correctional Centre in Alice Springs. Do we have any idea how that was passed on to prisoners?
Again, I think we all have to be very realistic in the Northern Territory. When you go out, the whole place is effectively a potential COVID risk now. COVID is in the community, and so it can be spread very easily, and we know Omicron spreads extremely quickly and very easily. So we don't have a source of where it has come in from, but it's fair to say, again, we cannot reinforce enough the importance of vaccination, of making sure you keep your distance from people where you can, the hand hygiene and those good health measures that you can put in place every day yourself.
Do you know how many cases there are at the Regis Chile Aged Care Home in Darwin and at the Old Timers Home in Alice Springs?
We'll get back to you with the numbers of where they are at today with regards to those.
Do you know how many of them are in hospital?
I had previously known that we had one person from Old Timers, but that was more so for observation. I just don't have an update on where that case is at.
Are you confident that, given that we've got staff shortages around the country and the NT as well, that you can handle an outbreak in the aged care homes?
Well, aged care is always a challenging place for people to find staff, but they have COVID management plans too, and they have been working towards the day where we'll see more COVID in the community, so they have their plans in place to deal with those challenges.
What measures are put in place to help outbreaks in aged care homes here in the NT?
Well, they have their COVID management plans in place, and of course, if they're having particular issues, then we do help, we do assist, and of course, aged care home residents have access to our hospitals and to our healthcare system too.
This might be about for the
Joe?
show. Yep.
Okay.
What do you, I have a question as well.
Okay.
Is there any modelling yet on the NT's outbreak and when we're likely to see a peak in cases?
Yeah, no, we don't know. There's so many unknowns in this, but I suppose what we can draw upon, obviously, is the original documentary modelling, but that was obviously Delta-based. So Omicron has really taken us a little bit by surprise nationally. It coincided, Omicron arrived at the time when we were letting down our defences. And so the peak in numbers is enormous. We've had this year, just in the last 2 weeks in Australia, more cases than we had in the entire pandemic before that. So it's an enormous wave. What's reassuring, though, is that the number of hospitalisations, although it is greater than we've had in the past, is nowhere near at the same rate as we've had with the previous, mainly Delta wave. So, and also ICU admissions. What we're seeing in the Territory to this stage is a relatively moderate number of hospitalisations and ICU admissions. However, I don't want to sound at all complacent because we're right, we're at the beginning. We may, my guess would be, but there is no one can give us a good answer on this, but we probably got at least 2 or 3 or 4 weeks to go before we know what the peak will be. In Australia, again, we're in the same situation. Victoria is clearly facing, is on the upward swing. New South Wales may have started to reach its peak, but we're taking some comfort from the Omicron being less virulent, although it clearly is capable of putting people in ICU, and it is clearly capable of killing people.
With regards to the lower than expected or lower than anticipated hospitalisations, is that primarily because of the vaccines or because Omicron is milder?
Yes, that's a good question. Look, we don't really know, but it'll be a mix of those things. Vaccination clearly has been a major benefit to Australia, and it clearly has significant benefit of the first and second dose, even with Omicron. But the booster dose gives us good protection and prevention from hospitalisation. So again, boosters are really very important. We must, anyone who's eligible should come forward, and that will give them good comfort about a protection. There are other factors. We've got good treatment now. We're finding that in the Territory. Our clinicians are advising us that they're seeing good responses to treatment, and we have no shortage in the Territory of the important first-line drugs. There are new drugs coming, which will be coming to Australia. So that is going to become an increasingly important part of what we can do. But nevertheless, with all of those things, masks, distance, and the other measures that we've put in place, and the vaccine pass and so on in the Territory, are still going to be very important for some time. We will obviously be watching very closely over the next few weeks what happens to us. We are concerned about outbreaks in communities, and we're monitoring those very carefully and managing those very actively, as you will see. So I'm afraid I can't answer I didn't give you a simple answer to your question, but clearly we've got some anxious few weeks while we watch this, but we're taking some comfort, but the hospital impact is what we are concerned about, is what level that might peak at and what pressure it might put us under. But so far, we are managing.
Minister, we're hearing reports that the New England football team played a game in Papunya yesterday.
Papunya.
Yeah, that's it. Is that acceptable in a lockout, and does that risk further spreading?
I haven't got any information with regards to that, so no, I haven't got any information with regards to that. So we'll get.
Moving between communities
So I can't really comment on something that I have no information on, but it'd be fair to say that Yuendamu is in a lockout situation, that we know that those who are not vaccinated are unable to leave their homes, and so we'll get more information, we'll look into it and we'll get back to you.
Is there a specific reason why, you mentioned that more text messages for exposure sites will be going out today, why they haven't been sent already?
Yeah, so we've had some go out last night. We've got more that are going out today. My understanding is that they'll be getting out as quickly as possible over today. I don't have the reasons why they didn't all go out last night.
It's not because there's like a massive backlog or anything like that?
We know that we've got thousands to go out, and they'll be getting out as quickly as possible.
You answered my question, so to speak.
Thank you, everyone. Thank you.
Sorry, so we come to over?
Did the woman who passed, did she have underlying health issues, or was it simply she did? Did she? Thank you.
Which is often, the danger with COVID.
Yeah, indeed. Thanks, guys. You have a good day, everyone. Thank you.
Yo, thanks, Craig.
It belongs to
Thank you. Have a nice weekend, everyone.
Just a easy question.